So, hi Daniel, thank you for your time. Can you tell us a bit about your background and why you've written your book, Paranoia?
Yeah, so I'm a clinical psychologist. I work in Oxford Health, NHS Foundation Trust, but also a professor of psychology at Oxford. And I studied natural sciences where I first tried psychology and absolutely loved it, and then trained as a clinical psychologist. But I started, I guess, at a really fascinating time for the psychological therapy of psychosis. When I started, there wasn't really provision of psychological therapy. That in fact, you wouldn't really talk about the content of psychotic experiences. And I started actually as a research assistant on a trial of psychological therapy for psychosis, which was, one of the trials that helped actually change the provision of psychological therapy for people with psychosis. So from the very start, really, I've always really enjoyed working with people who've got these sorts of difficulties. And for me, the first generation CBT for psychosis opened a huge door in terms of allowing psychological therapy to use with people with psychosis. But actually what I wanted is, well, once you do that, what's the best way of working with people? Can you develop a really effective psychological therapy? And I spent a lot of my career trying to develop that. And a couple of years ago, published the main trial of that new therapy called Feeling Safe. The results are really good. And at that time, and also during the sort of the initial stage of the pandemic, I thought maybe it's time to look back at the progression of the area and all the sorts of work I've been doing, and the story really about not only treating severe paranoia, but the prevalence of the mistrust in society as a whole and what that means. So yeah, a bit of a look back and thinking about the story as well as the science of paranoia, the progress has been made. And also just to give voice to many people who are having these experiences because they're often not heard.
Thanks, thank you. And what is the link and the distinction between psychosis and paranoia? Is paranoia always a feature of psychosis?
So psychosis is very much an umbrella term. It can mean quite a lot and be used in quite a number of different ways. Often these days it's really used to refer to diagnosis of schizophrenia, but it can be much broader than that. But I think it's often used as a shorthand for schizophrenia. And really what you want psychosis is an umbrella term that covers a multiple range of linked but distinct experiences, including paranoia, grandiosity, voices, anhedonia, things like that. And really what I think is that, well, what I started is really the idea was that paranoia only occurred in people with psychosis. It was a symptom of schizophrenia. You treated the schizophrenia by medication, and and you didn't need to talk about experiences. But actually, what I think really is that there's a paranoia spectrum in the population, just as there is for anxiety and depression. Many people have a few paranoid thoughts. Few people have many, and really, the patients we see are just the higher end of a spectrum in the general population. And when I'm talking about paranoia, what I'm particularly talking about is inaccurate ideas that others are trying to harm you in some way. So you think others may be trying to harm you socially, physically, financially, when they're not.
I'm wondering about this spectrum and that specific definition there about people wanting to harm you in some way. I mean, where then in a milder case would you draw the line between anxiety and paranoia?
Yeah, so what you don't get as anxiety is this idea that others are deliberately trying to harm you. So in social anxiety, you often think that others, you may look foolish in front of other people, for example, but you're not necessarily thinking that others are trying to make you look foolish. So it's an attribution of intent that separates them out, but they are closely linked. Paranoia has a strong vein of anxiety running through it as a causal factor, I think. So they are linked. There's a lot of shared understanding. A lot of my work has actually been making the links. So because in diagnostic systems, you've got this huge chasm between psychosis and neurosis. Neurosis has always been sort of used as understandable psychological treatments. could be very helpful, and psychosis was viewed often as qualitatively different. So when I started off, I was making links between anxiety and paranoia, and one of the first studies I did was measure levels of worry in people with persecutory delusions, compare them to people with generalized anxiety disorder, a disorder characterized by worry. And that was the first time worry had been measured in people with psychosis, because worry was thought as an aspect of neurosis. And actually, we found high levels of worry in patients with severe paranoia. And then we went on to show that if you reduce the worry through psychological treatment, that also brings down the paranoia too. So they are linked.
Interesting. And I mean, you mentioned the pandemic, and I mean, today it feels like trust has been eroded in governments and institutions, sometimes for good reason. I mean, how can we stay anchored in reality, and how can we pick up on paranoid thinking in ourselves?
Yeah, I mean, I think there's a number of things about that. One is obviously paranoia doesn't arise out of nowhere. All of us have to make decisions whether to trust or mistrust. And sometimes it's right to be skeptical, and sometimes it is right to be fearful, because there are real dangers out there. So it's a kind of judgment risk, and that's something we all do. When it tends to get out of hand is when we feel very vulnerable, when we start to isolate, when we worry, when we find it hard to get some distance from the thoughts. And really, I think with all psychological disorders, it is about we're all more psychologically unhealthy when we're not engaged in activity that's meaningful for us. And that cuts across, I think, for many disorders, all disorders. And then, of course, a blocker of us getting engaged in meaningful activity is if we're too caught up in thoughts, particularly when they're inaccurate, and therefore the ability to pause, reflect on those thoughts, share, think of alternatives, is really helpful. But of course, underlying that, there's a whole lot of other things you typically have to sort out, which is often helping people sleep better, build up the confidence that they feel so vulnerable, and worry less, for example. So really, certainly in patients, to overcome paranoia, what we're doing is helping people relearn that the world is safe now for them to get back doing what they want to do. But we have to get people into a psychological state to make that learning, because if you can go back into everyday situations and they will could be re-experienced as quite threatening, even if nothing happens, because you may be worrying, you may be using various defenses that you think, well, I just wasn't harmed because I got out of there fast, or I didn't go into that shop or have that conversation. So we have to get people into the right psychological state to go back into situations to relearn safety. That's in terms of the more clinical end. In terms of general mistrust, there's obviously steps at the individual level, but of course, what you also find is that more socially unequal, where there's social disunion in society, you're going to see high levels of mistrust as well, for a number of reasons.
And will that only increase really as we expand our technology with tech and AI and social media even?
Well, I guess probably this year with all the elections and things, the divisions are going to occur between people. It's not probably going to be the best year in terms of renewing trust, would be the guess. But yeah, I mean, I think the more issues of inequality and marginalization of people, you're going to get high levels of mistrust. And I think you've also got sort of post-truth, the sense of you can go on your feelings rather than actual facts. And then, of course, on social media, you can find these ideas, they're propagated, and you can get all the echo chambers. So yes, I think that's one of the reasons why conspiracy beliefs have gone mainstream, I think, but also it fits in with general levels of mistrust. And yeah, I think it is rather difficult times.
Yeah, it's the case of making decisions based on evidence rather than emotion. I find it I understand it in terms of paranoia and mistrust, but more broadly speaking, is it realistic as a goal or even desirable, do you think?
Do you trust?
No, to be able to make decisions removing emotion from them.
No, I mean, decision making is often we may be following people around us, for example, we're picking up from friends and family and the environment, and people obviously, there are difficult situations people are living in where, paranoia can be well, not paranoia, a wise strategy is to be more mistrustful. It's when it gets too much. But no, I mean, I think, obviously a lot of judgment goes on feelings, but we have to be able to check those out. Obviously, what we call gut feelings are often this sort of instant decision making, which can be useful, but the ability to pause and reflect and weigh things up can be incredibly helpful. And there's certainly evidence that if you're able to do that, then you can lessen inaccurate thoughts. And I think it's about the inaccurate thoughts, but it's also the thoughts that stop you doing the things you want to be doing. So when I work with patients, really what we're aiming for is to help people feel safer, happier, and getting back doing more of the things they want to be doing. That's where we're focused. And of course, there are real situations that mean that's hard, but that of course is not paranoia. Paranoia is not when you are when you're perceiving genuine threat. It's when actually you're seeing threat that isn't there.
Yeah, absolutely. And it seems such a key component of your work, this idea of sleep. And I was wondering about what the latest thinking is on the best treatments for sleep.
Yeah, so this sleep is a really interesting one that I've worked maybe over the last 10, 15 years on, and it was incredibly neglected. It was as a topic in mental health research and treatment. It was thought as a non-specific symptom, not tied to a diagnosis, and therefore unimportant. But of course, what you've got in mental health conditions, there's a lot of shared causation, and sleep, I think, is one of them that contributes to many mental health problems. And all the evidence we gathered basically is showing that if you can treat the sleep problems, you're going to lessen a whole range of other problems: anxiety, depression, paranoia, hallucinations, for example. And that makes obvious sense. I think that all of us know that if you haven't slept well, you don't feel so good the next day. So really been trying to turn this view around from standard mental health services that sleep is not important or just a consequence of mental health problems, to actually putting it a little bit more center stage. And that has huge advantages, certainly working with people who are feeling very mistrustful, that it's very easy to agree in therapy that actually, oh God, you must be shattered not sleeping. And the person can agree, and we can work on that and build up the therapeutic relationship before we go on to some other issues. So it's really helpful. The evidence we've got consistently from our work with patients newly admitted to psychiatric wards, all with current delusions and hallucinations, also working with young people at ultra high risk of psychosis, is that we can get large improvements in sleep through forms of cognitive behavior therapy for insomnia. So in essence, getting circadian rhythms right, getting the sleep window right, building up the sleep pressure during the day, and developing, allowing the mind and body to relax prior to sleep. There's a whole range of techniques we do, but in essence, pushing on the main mechanisms of sleep through CBT techniques can be really helpful. We get large improvements in sleep, and that has knock-on benefits in other areas of people's lives. So it's often a first start in therapy when we work with people with psychosis.
And what about more generally tips for overly anxious thoughts or paranoid thoughts?
I mean, I think in psychological health, I think it's a number of things really, isn't it? The circadian rhythms I mentioned actually is very helpful. So actually thinking about the timing of sleep, but also of your meals, activity in the morning, getting sunlight. So some of those are the basics of good mental health, as well as getting some exercise. Limiting time spent worrying, boosting self-confidence is always important. Talking to people, sharing, and then always really our aim and the route to which we get therapeutic change is getting people back engaged in meaningful activity. If you are engaged in that, your mind is typically focused on that, and it's not so self-focused. So that in the end is where we're always headed. We're thinking, well, what do you want to do? What's meaningful to you? And can we enable you to get back to doing that? And that really is one of the key routes to change.
And it strikes me in the realm of mistrust, something like therapy or counseling could be all the more challenging to engage with for the patient to trust their therapist. But is that also part of the reason why it can be so valuable for this group?
Yeah, so you can get the change through someone experiencing a positive therapeutic relationship. And there's no doubt that even general work on befriending can be really helpful for people. Obviously, at times engagement can be hard, and you need to think certainly some of the people we work with might be hearing voices that may be saying stuff as well. So we have to anticipate that. However, we get in our team very good engagement with patients because always our first step is curiosity and respect. So we respect the person and we genuinely want to find out what's happening. And we start from the stage of if someone's telling us about the neighbor, we do not know what's happening. The neighbor could be doing bad stuff. So we are very curious to find out and hear how things are. And we also, I think, because of the feeling safe trial results, have a confidence in our approach that we can help people even if they're feeling a bit hopeless, try out some techniques pretty fast. And it might be getting people sleeping better, and that builds the relationship further. And then we can work on the worry, and then we can begin to move on to the work of, right, is the world safe enough now to do the stuff you want to do? And that's obviously can be very anxiety provoking for our clients, but we've got to a stage where there's enough trust there to move forward. So I would suggest that a good therapeutic relationship, all of that is really important, and that can be hugely beneficial in itself. But if you add in also the right psychological techniques, you can get even greater change.
Great. Thank you so much, Daniel, and congratulations on the book and all of your work that you've done. It seems so beneficial to the people
Thank
that
you.
you work with.
Pleasure to speak to you.
Thank you, Daniel. Take care.